To say that the dollars that were raised through the Foundation Save Lives would be a very true statement. I don't know what would happen if we weren't, if the donors were not there. More and more people would have to go elsewhere for procedures and for tests. I don't know that the regional hospital or the Fisherman's Hospital would exist in the same capacity if it wasn't for the donations that we receive.
I'm Arlene Stevens, Managing Director of the Health Services Foundation of the South Shore. The Foundation, through our staff and our board of 16 volunteers, work to make healthcare in our district the best that it can be. We raise money for Fisherman's Memorial Hospital in Lunenburg and South Shore Regional Hospital in Bridgewater. We support various medical pieces of equipment, but we also raise money for bursaries for medical students coming back to work in our district, and we also support nursing and physician recruitment. We also make big things happen. Like this, the Dr. Arthur H. Patterson Center, where I'm standing today. Since the inception of the foundation, we've invested over $11 million in both Fisherman's Memorial Hospital in Lunenburg and South Shore Regional Hospital in Bridgewater. Many donors to the hospital have areas that are of specific interest to them, maybe because they or a family member have benefited from that department, or maybe even had life-saving care.
In the oncology department at South Shore Regional Hospital, and a number of years ago we had a donor whose wife was a patient here, and she always was cold when she was getting her chemo treatments, and so he purchased one of these beautiful specialized chairs that actually have heaters in them and they have massagers in them. So when he had heard that the patients really enjoyed them and liked having the comfort when they were going through their treatments, he purchased another 6. So these are wonderful chairs that we were very fortunate to get from a wonderful donor. So that's just one way that we raise money for the oncology department at South Shore Regional Hospital. We're also very fortunate to have the Rose Fund, which is a cancer patient assistance fund. This fund is available to cancer patients on the South Shore who may be in need of financial assistance during their cancer treatments. We also have the David Atkinson Memorial Fund, which is raising money for the oncology department at South Shore Regional and will be used to purchase equipment or staff training, or perhaps someday a cancer patient resource room.
With the help of donations from a very generous community, we make things like this possible through direct mail campaigns, special events like Hit It for Health, Curl for a Cause, and our Radiothon.
The Radiothon is one of our largest, well, it is our largest fundraising event that we do, and it's the newest event that we do. It's funny because people say, wow, you raised all that money in one day. Yes, one day we're on the air, but we actually start planning for Radiothon 5 to 6 months ahead of time. It's a lot of sending out letters, it's a lot of going and visiting community groups, going into schools, it's talking about the equipment, it's talking about what we're going to do, it's asking businesses to support it, it's asking businesses to donate to the auction, making sure that we have all of the 50 volunteers. Because we have so many donors at one time, it takes a lot to enter all the information into the computers and do all the receipting, because there's about 550 donors. It's a lot of paperwork after the fact, plus counting the money and doing the bank deposits and all of those things that go with it. It does take a lot of time.
It used to be, when I arrived here at the Health Services Foundation and started working just in 2002, that it seemed every few months we would get a request for a relatively inexpensive piece of equipment that we could easily purchase or fundraise for. But over the last decade, that's really changed a lot, and we see that most board meetings that we may have 1 or even 2 requests from the district every board meeting. So what used to be maybe a $20,000 or $30,000, $40,000 ask on occasion is now regularly an ask of a few $100,000 for very expensive and critical pieces of equipment that the government's just not funding anymore. With Curl for a Cause, I work with a committee of about 10 people. We take probably 4 to 5 months to put this event together. It's 3 solid days of a curling marathon. It's a fun event. We have participation from over 500 people in the community of Lunenburg.
so nice to be part of an event like this where the whole community participates.
$39,706.
It really is seeing the donors and getting a good relationship with them, seeing how happy it makes staff when we buy a piece of equipment that they like and are excited for. And they really do come in and get excited and tell us how happy they are to have new equipment and how much easier it makes their job. It's really great to see. And it is great knowing that people do get to come here for more procedures and they don't have to go so far. And it's actually helped me as well with my children. So I enjoy it, seeing the immediate results.
The process is there's a list of items that the hospital requires. This was actually at the top of the list. The portable digital x-ray unit was at the top of the list. The 2 units that we currently had in the hospital were very old. One was, I think, 27 and one was 33 years old. It's a $225,000 piece of equipment, and there was no government funding for it. We actually started fundraising for this specific piece of equipment in October of last year. And we started with Jeans and Gems, our very first event. For the X-ray unit was the Jeans and Gems event, and it raised $20,000 to kick off the campaign. We were very fortunate that night. There were people in the room who knew how important it was and who understood our need and how much money we had to raise, and they gave us a gift of securities valuing at $25,000. At Christmas time, we do a direct mail campaign. It's a campaign where we send letters to not only our donors, but to every household in Lunenburg and Queens. And I think we made about $70,000 on the direct mail campaign, also going towards the unit. And then to finish it off, we had our radiothon. The radiothon raised over $100,000, and all of the money from that will also go to this unit. We're still a little bit short. We have applied for a grant. So you can see that there's all kinds of ways that we raise money.
Our donor base is really great here. We live in a fabulous community, a very giving community. That's one of the big things that I enjoy about the job. I love it when the donors come in our door and I get to meet them and talk to them. A lot of them I know because I've been here over 20 years. We were audited a year ago, February, which is not usually a good thing, but it was a general audit and we passed with flying colors. They said if more charities were like ours, that they would be at work. So we were really happy with that. It's good for our donors to know too that we're good stewards and make sure that their money goes where we say they go and that we're using it wisely.
The main thing of this job is actually getting to know your donors and getting to have build a relationship with your donors, because really you can have all the special events you want, or you can have all of the radiothons or direct mail campaigns, but if your donors don't trust what you do and you don't have a relationship with them, then you're not going to receive their donations. It's great to be able to raise the money, and it's great to be able to buy the equipment, but the real excitement to me comes from making a difference and knowing that what we do every day makes a difference to somebody. And it may be somebody we've never met, and it might be something that we never hear about, but you know that if you're buying a heart monitor, that there's going to be a patient on that heart monitor. You know if you're buying new beds, there are people who are staying in those beds, sometimes long term, and that they're the most comfortable they can be. You know if you're buying a crash cart for the pediatrics for the emergency room, that there might be a child someday whose life is saved because of the work that you've done to bring in the money to pay for those things.
The need for fundraising in the hospitals will not go away. We always want to buy the most current technology that we can buy for patients in our district. That is expensive, and of course this medical equipment has a certain lifespan. So we will continue to fundraise in our community, and we're fortunate that the donors in Lunenburg and Queens County support their hospitals and certainly support the foundation.